Hello everyone, this is Rishil Reddy and today I am going to discuss the topic on wound healing. This video is presented by MEDeaze and MBBS Freaks. Now let's see what are the learning objectives in this video. They are types of wound healing, phases of wound healing and factors affecting wound healing. Let us come to the first objective, that is types of wound healing. Types of wound healing are grouped into majorly three types: primary healing, secondary healing, and tertiary healing. The primary healing is also called as healing by first intention, and secondary healing, healing by second intention, and last, tertiary healing, healing by third intention. Primary healing means the healing which occurs in clean, incised wounds or surgical wounds. The healing occurs only by simple suturing. Whereas secondary healing occurs in the wound where there is extensive loss of soft tissue. The re-epithelialization occurs from the dermal elements which are present at the site of injury. At last, tertiary healing. Tertiary healing also occurs same as the primary healing, but it is seen in the wounds which are contaminated. The healing occurs simply by the suturing, but it is seen in contaminated wounds after debridement and control of infection of the wound. The simple difference between primary healing and tertiary healing is that tertiary healing occurs by simple suturing, but in the wounds which are contaminated and the debridement and control of infection has been occurred. Now let's move on to the next part of the video, that is phases of wound healing. There are totally 4 phases of wound healing through which a wound passes to get completely healed. The first phase is hemostasis. Let us consider this as a blood vessel and these are the elements of the blood. Elements of the blood, majorly we can see RBC, WBC. In WBC we can see neutrophils, macrophages and these are the fibroblasts and these are the platelets. First, when a wound occurs to the vascular endothelium, the damaged epithelium releases specific factors like von Willebrand factor and other factors. These factors then activate the platelets, which leads to formation of a temporary platelet plug at the site of wound. This formation of the temporary platelet plug helps to prevent the loss of blood from the site of injury. As the time evolves, the aggregation of these platelets releases further platelet derived growth factor, epidermal growth factor, transforming growth factor beta, and platelet activating factors. These factors leads to further aggregation of the platelets. This forms a temporary platelet plug. Now let's come to the second phase of wound healing, which is inflammation. In the process of inflammation, the injured tissue and platelets, they release specific factors like interleukin 1, tumor necrosis factor alpha, transforming growth factor beta. These factors attract the neutrophils, which are the cells of first line defense. These neutrophils causes the phagocytosis of the permanent platelet plug and leads to the formation of debrid. By this, the remnants of the phagocytosis will be remain at the site of wound. After the function of neutrophils, second, there will be aggregation of macrophages, which are the cells of second line defense. These macrophages are responsible for removal of the debris which is formed as a remnant of phagocytosis. During this process, even the lymphocytes also get aggregated and release some inflammatory mediators. The inflammatory mediators released by these lymphocytes are like histamine and serotonin, as well as prostaglandins. These inflammatory mediators are responsible for the formation of inflammation at the site of injury. Finally, there is formation of an inflammation at the site of injury. Now let's come to the third phase of wound healing, that is proliferation. During proliferation, the cells of the vascular endothelium surrounding the site of injury releases some specific factors like vascular endothelial growth factor, tumor necrosis factor alpha, and transforming growth factor beta. These factors are responsible for angiogenesis, that is formation of new blood vessel. During this process, there will be activation of the fibroblast cells which are responsible for the deposition of type 3 collagen at the site of inflammation. And by the process of angiogenesis, there will be re-epithelialization by migration of basal layer of retained epidermis to form the closure of wound. Now, let's move on to the last phase of wound healing, that is remodeling. In the remodeling phase, the type 3 collagen which was deposited in the proliferation phase will be replaced by the type 1 collagen fibers. After a certain period of time, finally there will be formation of a matured scar which is acellular and avascular. There will be reepithelialization and formation of a matured scar. This was a brief discussion about the phases of wound healing. Now let us come to the last topic of this video, which is factors affecting the wound healing. Factors affecting the wound healing are grouped into majorly general factors and local factors. The general factors are like age, malnutrition, vitamin deficiencies like vitamin C, A, K, anemia, any type of malignancies, uremia, jaundice, diabetes, HIV infection, use of steroids and other types of drugs, and finally, some kind of neuropathies. These are the general factors which affect the wound healing. When we come to local factors, they are like infection at the site of wound, presence of any foreign bodies, poor blood supply, excessive tissue tension, hematoma, any large defect, recurrent trauma, X-ray irradiated area, the site of wound. Under local factor, the site of wound has a major role because, for example, the wound which occurs over joints and back have a poor healing process. The other local factors are like diseases and type of wound. Here, in the phases of wound healing, let us see the time duration of each phase. The hemostasis, which begins immediately after the formation of wound. The second phase, that is inflammation, which lasts for 72 hours. Then proliferation, which is seen from the third day to 3 to 6 weeks of period. And finally, the last phase, which is remodeling phase, it lasts for 6 weeks to 1 to 2 years. So finally, we end up this session. Thank you all.